Okay, so today we're going to be looking at the upper limb, and this is an overview of the structures of the upper limb. So before we start, I want to orientate you. So this is the anatomical position, and for the upper limb it's important that we note that the hand is supinated, so the forearm is supinated. So that means that the palmar surface is going to be the anterior part, and that's important for you to get in your head to understand the spatial orientation. So we have some distinct parts of the upper limb. So what most people would call the arm is actually from about where your shoulder is to your elbow joint, and then your forearm is from the elbow joint to the wrist, and then you have your hand. So the arm actually specifically refers to this part of the upper limb, whereas the upper limb is the entire limb itself. And we have fascia, or connective tissue, that surrounds the parts of the upper limb. So we have the brachial fascia that surrounds the muscles of the arm. We have the antebrachial fascia for the forearm, and then on the palmar surface of the hand we have the palmar aponeurosis, which is like a thickening of the fascia there. And then we also have retinaculi, which are again thickened, very thick, very hard to cut through if you're dissecting through these structures. And it's important to note that we have an extensor retinaculum on the dorsal surface of the wrist, and then on the palmar surface or anterior side we have the flexor retinaculum. The flexor retinaculum is important as it serves as the roof of the carpal tunnel. More on this in another video. Compartments and muscles. So in addition to there being muscles within the arm and forearm, we also have some muscles from the rotator cuff which supply stability to the shoulder joint. We also have muscles in the pectoral region and the extrinsic back muscles, all of which help to move the upper limb, but I'll explain these later in another video. The arm, so the upper portion of the upper limb, has two compartments, flexor and extensors. So these are the two compartments, and the forearm also has two, the flexor and the extensors. And the arm will flex and extend the elbow joint and sometimes the shoulder joint. So there are some muscles that do that. And the forearm will do flexion and extension of the wrist joint, mainly, amongst some other movements. Again, I will explain in another video. And then generally, muscles of the flexor compartments are anterior, again, an anatomical model, and the extensor muscles are in the posterior compartment, so the posterior aspect of the limbs. And again, in another video will be explained. So, with this knowledge, this is the anterior compartment of the arm. With what I've just told you, what would the action of this set of muscles be? I'll give you 5 seconds. It's going to be a flexor of the elbow and the glenohumeral joint or the shoulder joint. Okay, and one more example. If I told you this is the posterior compartment of the forearm, what would you expect it to do? 5 seconds. It's going to be an extensor, or if these are extensors of the forearm. Generally, there are always exceptions to rules, but it's important to learn the general idea and then learn exceptions to the rules. Okay. And now just other miscellaneous parts that I will add to in subsequent videos. So we have the cubital fossa, colloquially known as the vagina, and this is anterior to the elbow joint. So here, this triangular shaped structure. And then we also have the carpal tunnel here, which, as mentioned before, is the roof is the flexor retinaculum, and this is important clinically as you get carpal tunnel syndrome, which is compression of the median nerve here. But I'll go through the anatomical boundaries and landmarks of these structures later, as they're quite important.